In this video, I'll cover 10 essential community pharmacist interview questions, providing expert guidelines, ideal responses, and real-life scenarios to help you excel in your interview. This is one of 15 videos designed to fully prepare you for a community pharmacist interview. So, let's begin. Question 31. How would you advise a patient who forgets to take their medication? The following are guidelines of how to approach this question. When answering this question, demonstrate strong communication skills, clinical knowledge, and patient-centered care by providing clear, practical, and safe advice. Employers ask this question to assess your ability to offer appropriate guidance based on the type of medication and its pharmacokinetics while ensuring patient safety. Emphasize your ability to assess the situation, identify risks, and deliver tailored advice in line with established guidelines. When answering this question, avoid giving generic or unsafe advice that does not consider the specific medication's properties, such as its half-life or risk of toxicity. Strong knowledge of the Pharmaceutical Society of Ireland, PSI, Guidelines on the Counselling of Patients and the Misuse of Drugs Regulations 2017 is important as it ensures pharmacists provide accurate, safe, and lawful advice while prioritizing patient safety. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If a patient forgets to take their medication, my first step is to assess the type of medication, the time elapsed, and potential risks involved. I would advise the patient to never double the dose unless specifically instructed. For time-sensitive drugs like oral contraceptives, I would provide tailored guidance based on the missed dose protocol. For most medications, if it's close to the next scheduled dose, I would recommend skipping the missed dose. I ensure to explain clearly while reassuring the patient and advising on ways to prevent future missed doses, such as using pill organizers or medication reminders. Example scenario. I remember when a patient on warfarin approached me after forgetting their dose the day before. Understanding the narrow therapeutic index of warfarin, I carefully assessed the timing and confirmed no signs of bleeding or bruising. I advised the patient not to double the dose and immediately contacted their anticoagulation clinic to arrange an INR check. This ensured patient safety while providing clear steps to manage missed doses. I also educated the patient on using a medication tracking app to prevent future missed doses. This experience reinforced my commitment to delivering safe, patient-centered care while adhering to PSI guidelines. Question 32. How do you ensure proper medication storage in the pharmacy? The following are guidelines of how to approach this question. When answering this question, a candidate should demonstrate attention to detail, knowledge of regulatory standards, and commitment to patient safety. Employers ask this question to assess the candidate's ability to maintain medication integrity, ensure legal compliance, and manage temperature-sensitive products. The response should highlight organizational skills, familiarity with storage requirements, and proactive monitoring practices. When answering this question, avoid vague responses that do not specify practical steps or legal standards. Strong knowledge of the PSI guidelines on the storage of medicinal products and the misuse of drugs, safe custody, Regulations 1982 is important as it ensures compliance with legal storage conditions and controlled drug security. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. I ensure proper medication storage by adhering to PSI guidelines and implementing strict temperature monitoring using calibrated devices to maintain the integrity of temperature-sensitive medications like insulin and vaccines. I regularly check expiry dates and follow a first expiry, first out, FEFO, system to reduce medication wastage. Controlled drugs are stored in compliant safe custody cabinets as per misuse of drugs regulations. I also conduct routine audits to identify storage issues and provide staff training to maintain compliance and patient safety. Example scenario. I remember when I discovered that our pharmacy's fridge temperature had exceeded the acceptable range during a routine check. I immediately quarantined the affected stock, consulted the medicine stability data to assess viability, and reported the incident in line with PSI requirements. I then arranged for the calibration of the fridge and introduced twice-daily monitoring to prevent recurrence. This proactive approach protected patient safety by ensuring that compromised medicines were not dispensed and improved our pharmacy's compliance practices. Question 33. How do you handle a situation where a GP prescribes a medication that has a serious interaction with a patient's existing medication? The following are guidelines of how to approach this question. When answering this question, it is essential to demonstrate clinical knowledge, communication skills, and patient safety awareness. Employers ask this question to assess your ability to identify and manage potential medication-related risks while collaborating effectively with healthcare professionals. You should emphasize your ability to analyze drug interactions, promptly contact the prescriber, and ensure the patient's safety without delaying treatment. When answering this question, avoid blaming or criticizing the GP, as this reflects poorly on your professional communication skills. Strong knowledge of the PSI's guidelines on the keeping of records in pharmacies and the Medicines Act 2003 is important, as it ensures proper documentation and adherence to legal requirements when addressing medication-related concerns. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If I identify a serious drug interaction, my priority is to ensure patient safety while maintaining open communication with the GP. I would first review the clinical significance of the interaction using trusted resources such as the BNF and Stockley's drug interactions. I would then contact the GP immediately, providing clear, evidence-based information about the interaction and suggesting appropriate alternatives if necessary. Once a resolution is agreed upon, I would counsel the patient thoroughly, ensuring they understand any changes to their medication. Finally, I would document the interaction and the outcome in accordance with PSI guidelines to ensure a clear record of the intervention. Example scenario. I remember when a GP prescribed clarithromycin to a patient on simvastatin, which posed a risk of rhabdomyolysis due to increased statin levels. Recognizing the severity, I immediately contacted the GP, explained the interaction mechanism, and suggested switching to azithromycin, which does not inhibit CYP3A4. The GP agreed, and I informed the patient about the change and monitoring signs of muscle pain. This collaborative approach prevented a serious adverse event, and I documented the intervention thoroughly, ensuring compliance with PSI record-keeping guidelines. Question 34. What would you do if a patient asks for an antibiotic without a prescription? The following are guidelines of how to approach this question. This question assesses your understanding of legal and ethical responsibilities as a community pharmacist and your ability to balance patient care with regulatory compliance. You should demonstrate clear communication skills, knowledge of Irish legislation, and a patient-centered approach while maintaining professional integrity. Employers expect you to show that you can handle patient requests tactfully, explain legal requirements clearly, and prioritize patient safety. When answering this question, avoid giving vague responses or implying that you would bend the rules to satisfy the patient. Strong knowledge of the medicinal products, prescription and control of supply, Regulations 2003, as amended, and the PSI's guidelines on the sale and supply of non-prescription medicinal products is important as it ensures compliance with legal frameworks and patient safety. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If a patient requests an antibiotic without a prescription, I would first explain that antibiotics are prescription-only medicines under Irish law and cannot be supplied without a valid prescription. I would then assess the patient's symptoms to understand their concerns and advise on appropriate over-the-counter treatments if suitable, such as analgesics or decongestants for symptom relief. If their condition requires further assessment, I would encourage them to consult their GP and explain the importance of appropriate antibiotic use to prevent antimicrobial resistance. Throughout the interaction, I would ensure clear communication while maintaining a professional and empathetic approach to support patient understanding and trust. Example scenario. I remember when a patient with a sore throat requested amoxicillin without a prescription, believing it would resolve their symptoms. I explained that antibiotics are only appropriate for bacterial infections and that most sore throats are viral and self-limiting. I recommended throat lozenges and analgesics for symptom relief while encouraging them to consult their GP if symptoms worsened. The patient appreciated the explanation and returned a week later to thank me, expressing that their symptoms had resolved without needing antibiotics. This experience reinforced the importance of patient education in promoting appropriate antibiotic use and public health safety. Question 35. How do you educate patients about potential side effects of their medication? The following are guidelines of how to approach this question. When answering this question, focus on demonstrating effective communication skills, patient-centered care, and pharmaceutical expertise. Employers ask this question to assess your ability to explain complex medical information in a way that is clear, accurate, and tailored to each patient's needs. They expect you to emphasize patient safety, compliance with guidelines, and your ability to build trusting relationships. When answering this question, avoid using overly technical language that could confuse patients or failing to address patient concerns. A strong knowledge of the PSI's, guidelines on patient communication, and the medicinal products, prescription and control of supply, regulations 2003 is important as it ensures pharmacists provide clear, accurate, and legally compliant information to patients. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. When educating patients about potential side effects, I prioritize clear and simple language, ensuring they understand common side effects while addressing any serious risks that require immediate medical attention. I assess each patient's health literacy and adapt my explanation accordingly. I also discuss how to manage minor side effects and emphasize the importance of adherence while reassuring patients that I am available for further questions. I always confirm understanding by encouraging open dialogue and providing written information when appropriate. Example scenario. I remember when a patient newly prescribed amlodipine expressed concern about side effects. I explained that swelling in the ankles is a common side effect but reassured them it is usually mild. I also informed them about more serious side effects like dizziness and when to seek help. To ease their concerns, I provided a patient information leaflet and advised them to monitor their symptoms. By using clear language and addressing their questions patiently, the patient felt confident about taking the medication and later reported improved blood pressure control without significant side effects. Question 36. What do you do if a patient refuses to take a prescribed medication? The following are guidelines on how to approach this question. When answering this question, it is essential to demonstrate effective communication skills, empathy, and a patient-centered approach while balancing professional judgment and safety concerns. Employers ask this question to assess your ability to handle patient objections, provide accurate information, and promote medication adherence without being forceful. They expect you to explain how you engage with the patient to understand their concerns and provide evidence-based information while respecting their autonomy. When answering this question, avoid making assumptions about the patient's reasons or pressuring the patient to comply without discussion. Strong knowledge of the PSI's Code of Conduct for Pharmacists is important as it emphasizes the pharmacist's duty to communicate effectively, respect patient autonomy, and ensure patient welfare. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If a patient refuses to take a prescribed medication, I would first engage with them in a non-judgmental conversation to understand their concerns or reasons for refusal. I would provide clear, evidence-based information about the benefits and risks of the medication while addressing any misconceptions they may have. If the patient still refuses, I would document the refusal in accordance with legal requirements and inform the prescriber if necessary. Throughout the process, I would prioritize patient autonomy while ensuring they have the necessary information to make an informed decision and would offer ongoing support if they have future concerns. Example scenario. I remember when a patient with hypertension refused to take their ACE inhibitor due to concerns about side effects they had read online. I took the time to listen actively to their fears and explained that while some side effects like a dry cough can occur, the medication significantly reduces the risk of stroke and heart attack. I also discussed alternative options, which reassured the patient. After providing this information, the patient felt more comfortable and agreed to trial the medication with regular follow-ups to monitor for side effects. I documented our discussion and updated the GP to ensure continuity of care. Question 37. Can you explain the difference between the GMS and DPS schemes in Ireland? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's knowledge of public healthcare schemes in Ireland, as these schemes directly impact patient care and pharmacy operations. A strong response should demonstrate the interviewee's ability to clearly differentiate between the two schemes while showing their understanding of eligibility criteria, patient benefits, and reimbursement processes. The interviewee should exhibit clarity, accuracy, and confidence, as well as their ability to educate patients on their entitlements. When answering this question, avoid giving a vague or overly technical response without linking it to real-world pharmacy practice. A strong knowledge of the health, pricing and supply of medical goods, Act 2013 and the PCRS, Primary Care Reimbursement Service, guidelines is important as it ensures pharmacists provide accurate advice on medication reimbursement and patient eligibility. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. The General Medical Services, GMS, scheme provides medical card holders with access to free GP services and subsidized prescription medications, where they pay a €1.50 charge per item, capped at €15 per month per family. In contrast, the Drugs Payment Scheme, DPS, is available to all residents of Ireland, regardless of income, ensuring that individuals or families pay no more than €80 per month for prescription medications. The key difference is that GMS eligibility is means tested and provides a wider range of free healthcare services, whereas DPS is not means tested and only covers medication costs exceeding the threshold. Pharmacists must ensure patients are registered under the correct scheme to avoid unnecessary expenses. Would you like me to provide more details on how these schemes are processed in the pharmacy? Example scenario. I remember when a newly registered patient came in with a prescription for multiple medications but was unsure about their entitlements. Upon checking their records, I noticed they were not on the GMS scheme, despite qualifying based on their income. I explained the eligibility criteria, guided them on how to apply, and ensured they were covered for future prescriptions. In the meantime, I advised them to use the DPS scheme to cap their medication costs at €80 for that month. The patient was extremely grateful, as this saved them over €100 in medication expenses. This experience reinforced the importance of pharmacists being proactive in advising patients on the most suitable scheme for their needs. Question 38. What are the legal requirements for dispensing emergency contraception? The following are guidelines on how to approach this question. This question assesses your knowledge of Irish pharmacy law and PSI guidance regarding the supply of emergency contraception, EC, in a community pharmacy setting. Employers expect you to demonstrate a strong understanding of the legal framework, including patient assessment, documentation, and supply conditions. It also tests your ability to communicate sensitive health information effectively and ethically. When answering this question, avoid providing vague or incorrect information about the legal requirements, omitting patient consultation steps, or failing to mention the pharmacist's professional responsibilities. A strong knowledge of the medicinal products, prescription and control of supply, Regulations 2003 and the PSI's guidance on the provision of emergency contraception is important as it ensures pharmacists comply with the legal and professional standards when supplying EC. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. In Ireland, emergency contraception, EC, can be supplied without a prescription in a pharmacy under specific legal and professional guidelines. The medicinal products, prescription and control of supply, Regulations 2003 allow for the sale of levonorgestrel-based EC over the counter following a structured pharmacist consultation. The pharmacist must assess the patient's eligibility, ensuring EC is clinically appropriate and within the license time frame. Additionally, the Pharmaceutical Society of Ireland, PSI, requires proper documentation, including the completion of a patient consultation form, maintaining confidentiality, and ensuring the patient receives appropriate counseling on use, effectiveness, and STI prevention. If EC is not suitable or the patient presents outside the license timeframe, the pharmacist must refer the patient to a doctor or appropriate healthcare provider. Example scenario. I remember when a 22-year-old woman came into the pharmacy requesting emergency contraception on a Sunday morning. She was anxious and unsure about how it worked. I conducted a private consultation, ensuring she was within the 72-hour window for levonorgestrel EC and had no contraindications. I explained how to take it, possible side effects, and the importance of using regular contraception. I also provided advice on STI prevention and recommended a follow-up with her GP. She left feeling reassured and informed, and I documented the consultation as per PSI guidance, ensuring legal and professional compliance. Question 39. How do you handle a situation where a patient wants to return unused medication? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's knowledge of medicine disposal regulations, patient safety, and communication skills. The interviewee must demonstrate a strong understanding of legal and ethical considerations, as well as the ability to handle patient concerns professionally. It is crucial to highlight the importance of medication safety, regulatory compliance, and environmental responsibility. When answering this question, avoid giving an answer that suggests accepting returned medications for resale or reuse, as this is not permitted under Irish law. Strong knowledge of the PSI's guidelines on the safe disposal of medicinal products and the Waste Management Act 1996 is important, as it ensures compliance with legal and professional responsibilities while protecting public health and the environment. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. In a community pharmacy setting, it is important to handle medication returns in line with legal and professional guidelines. I would first explain to the patient that, for safety reasons, we cannot accept unused medications for resale or reuse. However, I would reassure them that we can safely dispose of unwanted or expired medicines through the dump, dispose of unused medicines properly, campaign, ensuring compliance with environmental and public health standards. I would also take the opportunity to counsel the patient on proper storage of medicines at home to prevent unnecessary waste. If the patient expresses concerns about the cost of wasted medication, I would discuss ways to optimize their prescription supply with their GP or prescriber to minimize excess dispensing in the future. Example scenario. I remember when a patient brought back a full box of unopened medication, explaining that their doctor had recently changed their prescription. They were concerned about the cost and asked if we could reuse the medication for another patient. I calmly explained that, due to safety regulations, we could not redistribute returned medicines, as we could not guarantee proper storage conditions once they left the pharmacy. I reassured them that we could dispose of the medication safely and suggested they discuss future prescription quantities with their GP to avoid excess dispensing. The patient appreciated the explanation and was relieved to know there was a proper disposal system in place to prevent harm to others and the environment. Question 40. What would you do if a colleague made a dispensing error? The following are guidelines on how to approach this question. When answering this question, it is important to demonstrate professionalism, problem-solving skills, teamwork, and a strong understanding of patient safety protocols. Employers ask this question to assess how well you handle errors in a pharmacy setting and whether you can take appropriate action to prevent patient harm while maintaining a collaborative work environment. They expect a response that emphasizes accountability, adherence to protocol, and effective communication with colleagues and relevant authorities. When answering this question, avoid placing blame on the colleague or suggesting that you would ignore or cover up the mistake, as this could indicate a lack of professional integrity. A strong knowledge of the PSI's guidelines on the safe supply of medicines and the Code of Conduct for Pharmacists is important as it ensures that dispensing errors are managed in a way that prioritizes patient safety while following professional and legal obligations. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If I discovered that a colleague made a dispensing error, my first priority would be to assess whether the patient has already received or taken the medication. If the error has been identified before the medicine reaches the patient, I would work with my colleague to correct it immediately. However, if the patient has already taken the incorrect medication, I would follow the appropriate incident reporting procedure, contact the patient if necessary, and inform the supervising pharmacist. I would ensure that the error is fully documented and reported to the Pharmaceutical Society of Ireland, PSI, if required, while also discussing how we can prevent similar errors in the future. It is crucial to handle the situation professionally and supportively to foster a learning environment while ensuring patient safety remains the top priority. Example scenario. I remember when a colleague accidentally dispensed Ramipril 10 mg instead of amlodipine 10 mg for a patient with hypertension. I noticed the error during the final accuracy check and immediately informed my colleague. We corrected the mistake before the patient left the pharmacy and conducted a root cause analysis to understand why the error occurred. Together with the supervising pharmacist, we implemented a double-check system for high-risk medications to minimize the risk of similar errors happening again. This experience reinforced the importance of teamwork, vigilance, and open communication in ensuring patient safety. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with others. Subscribe to this channel and hit the notification bell so you never miss an update in the series that we are doing. For more learning resources, check the description below. See you in the next video.